The most rewarding thing about this job is seeing the people who came in and they had a lot of deficits. Maybe they didn't believe in themselves or where they could get. And then getting them closer to that discharge day and seeing the look on their face, the look on their family's face when they know that they're going to go home. When they came into the hospital originally, whether it was an accident or a stroke, they were unsure of where this was going to go. And it's a source of pride for me that they came to us at the Spectrum Health Center for Acute Rehabilitation, and they got substantially better, and now they're going to go home. Because it comes down to quality of life. What's important to you, and how do you react when that's stripped away from you when you're injured, and then how do you get back to that? And that's what we focus on. Your goal is to get back home within a week. These are the barriers to getting you there. Here's how I'm going to get you to that point. And these are all the members of the team around me who are going to help you get there. You'll see people smiling, having a good time, even while they're rehabbing. Rehab shouldn't be a horrible process. It should be a fun process with the goal of getting you home. We get patients home at a higher level of function, and we get them home sooner when you compare it to the nation and region. We take very complex patients here. We take patients from lung, heart transplants, people who have elective orthopedic surgeries, trauma, traumatic brain injuries, strokes. All of our physicians are trained in all of these areas to address various concerns.
Well, my journey started in the intensive care unit and before departing for rehab, and what I became very aware of in a very intimate fashion was the teamwork that was applied within the unit itself. And then upon arriving at Blodgett in the acute rehab facility, it became very evident at a very early stage in my being there that there was an assembly of people that were gathered together to ensure that my outcome was expedited. Importantly, within the same unit, I had a continuity of care that was extended from the acute phase of my hospitalization. But it was very clear that in the course of my recovery, the course of my rehabilitation with physical therapy, with occupational therapy, with language therapy, cognitive therapy, I also received the sort of treatment that I needed for my wounds, for my individual lines, for decisions to be made with regards to ongoing issues of an acute nature that essentially saw me through that phase of recovery. And it's that impressed me the most. The fact that we're an integrated system of healthcare delivery. I want to be able to be in the same situation, for instance, when I discharge a patient from my service after having operated upon them. If I know that they're in a course of recovery within an acute rehab facility, that I can watch them recover, that I can go over and see them and examine them periodically, identify any given issues that may have some relevance for me that I may be able to intervene on and help them with their recovery. That's very meaningful to me.